Hey, hello. Welcome to an episode of Manta Care's Patient from Hell podcast club. My name is Mike Lynn. I'm a patient advocate here at Manta, and I'm going to be your host today. The goal of the podcast club pod is to take a look at researchers or clinicians as they explain their depth of work and to react to it as patients or patient advocates. Maybe more simply put, it's the way that we can see that data and standard of care is improved in the granular sense, because when we talk about the improvements in cancer treatment from 20 years ago, it has to get here somehow. So today's episode is funded by the Patient Centers Outcome Research Institute, or PCORI. The goal of this collaboration is to bring doctors or researchers onto the Patient from Hell podcast to share about their research so that more of us can learn about it and use it to help us in our lives as patients or care partners. The podcast club gives us the opportunity to chat with members of our community to get their perspective on an episode. So today, my guest is Sheila Goodrow, a metastatic breast cancer thriver and advocate. Hey, Sheila. I'm excited to hear your story and your thoughts on the pod episode. But before we get to that, let's start with your personal background in the cancer and advocacy space, and then we'll move on to the episode itself. Sheila?
Excellent. Thanks so much, Mike. I really appreciate having the opportunity to spend some time to chat about very relevant and important topics. My name is Sheila Goodrow. I was born and raised in Puerto Rico, but I've been living in Florida for, close to 30 years now. I am married. I have two young adult children in their 20s. I'm actually I work full time for a software company doing program management. I babysit adults because you need to get them to do what you want me to do, but they don't report to you. But love working with people in the space. I was diagnosed with metastatic stage 4 breast cancer almost about a little bit over 9.5 years ago. It was diagnosed de novo, which means I was never an early stage breast cancer patient. When I was diagnosed, it was already stage 4, which, as we know, obviously there's nothing worse than that, and it's not curable. I have been stable for about 8.5 years. Never had a surgery to remove the cancer. My treatment is just oral medications, and I'm able to still do the things I used to do before the diagnosis, with obviously some side effects that we all have to manage. And I started my advocacy journey, I would say, part one was as soon as I was diagnosed, just trying to get to drive my own decision making as we were figuring out which treatment to pursue. But about 5 years into my journey, I met the first person with metastatic breast cancer. She happened to be on the same medications I am still on, and started to discover different private support groups virtually, and eventually got to start meeting people in person. Became an advocate and just learned there's so many ways to advocate for self and others. And I currently volunteer for several nonprofits in various capacities, some of them as a mentor, some of them reviewing grants, some of them just kind of sharing information about the disease, resources, etc. And I discovered technically that, I will never understand why I got dealt the card. Just being able to share my story, I know, gives hope to so many others. And just sharing what I've learned along the way, because there isn't really a guidebook that tells you here's what you do when you're diagnosed. So very happy to be here.
Yeah, that's a lot of wonderful background. And the last sentence is verbatim what I've said so many times. It's like, when you get diagnosed, you expect that someone is going to hand you this, like, here's what you're going to experience, both from a physical. I expected to be Sherpa'd through this, and there's nothing. And that's, I think, why we're sitting here. You also mentioned that you're a project manager for a software company. My fiance is a PM for a tech company, and I understand the level of stress that builds in. So we're going to have fun talking about mental health today. The pod we're reacting to today, episode 84 of the Manta Care's Patient from Hell podcast, it features Samira Daswani, the founder of Manta, and Dr. Cara Bohon. If you haven't watched it, I recommend you go take your time to watch us talk about it now, but go back and figure it out later. But it's about Dr. Bohon's work as a psycho-oncologist, and how in that field, in psycho-oncology, or just for mental health resources for cancer patients, there is a lot of missing touch points. It's, whether there's not enough trained psycho-oncologists who have experience working with cancer patients, or the existence of these mental health resources and kind of the studies put out around them are not made readily available to cancer patients at the time they need them most. I know for me, when I initially got into my first diagnosis 7 years ago, I didn't have the mental capacity to go find these things. And it wasn't until things had calmed down between, getting through my first treatment, finding my own form of advocacy, that I realized there was enough out there if I wanted to go find it. But I don't think that's the way it should really be. You shouldn't have to go find it as a cancer patient. And so one of the first things that they talked about past their respective paths into the mental health journey of cancer, Samira and Dr. Bohon talked about how insomnia and sleep issues are things that plague cancer patients. And I think that's almost ubiquitous because one way or another, as a cancer patient, you're going to find yourself having trouble sleeping from stress, anxiety, diagnosed insomnia, pain from surgery. What has your experience been with sleep, whether it's as a patient or a caregiver or just a person stressing about their life in cancer? How's that affected your kind of journey?
I do from time to time just lay awake and it's not chronic insomnia, but there are days when it's hard to either fall asleep or I may just wake up throughout the night. Most of the time is the former, where I am exhausted, so ready to go to bed, and then I lay down in bed wide awake.
Yeah. Okay.
And I think part of it is sometimes there isn't a rhyme or reason. Sometimes there's so much stress going around, and most of my stress is actually work related. For some reason, I have been able, for the most part, to kind of compartmentalize and still kind of, we know that there's cancer diagnosis, but it's probably because I'm stable that most of the time it's not really the top concern in my mind. But even if I'm stable, though, some of the challenges and the stress come with, I have friends that have progression. I may have friends that passed away. So some of it's just that anticipatory grief. The other part of just not necessarily the insomnia, but waking on and off, it's just part of side effects from my medication. So my cancer responds to estrogen and progesterone. And before I was able to start my treatment, technically I got thrown into menopause by surgically removing my ovaries and tubes. And then one of the two medications I take reduces the production of estrogen further, which means hot flashes, which is probably the first thing that, almost anyone knows. They relate that with menopause. Throughout the night, there are days when I'm just waking on nonstop because it's hot, then it's cold, then it's hot, and it's cold. And it's not a very pleasant experience. But those are probably the two things that kind of plague me the most. There are times when I am very disciplined about going to bed at a certain time, so I get X amount of hours of sleep, and then it's enough. And there are days that I'm not. So those days when I am with the blue screen, just watching TV or something until close to bedtime, it may be harder. Sometimes I do try to do some things to kind of help ease into the sleep routine to try to make it more consistent and just try to get better quality of sleep.
Yeah, you touched on a few great points there. One thing I did want to interject is while we're generally talking about MBC and you brought up, early onset menopause or forced menopause in that sense, I can only relate because at one point during my treatment last year, I had a thyroid storm and the symptoms mimic that of menopause. I was told I was getting consistent hot flashes and, just pouring sweat, not able to control my body temperature. And my oncologist specifically, she said, or his assistant, excuse me, my oncologist assistant told me, yeah, this is pretty much menopause. And I was like, wow, this is not, I can't imagine.
How not fun.
Yeah. But the greater point that you made is that I thought resonated with me as well, because I have found stability in my treatment. And it's not so much that I'm laying there, worried about my day-to-day well-being, because that's built into being a cancer patient. At some point, you come to terms with what your disease represents and what the ramifications are. But the next step in living with cancer, whether it's during active treatment or as a survivor, is you're trying to figure out how you exist in a now new world. And there are still day-to-day responsibilities. There's still keeping a job. There's still caring for your family. There are still financial ramifications. Even if you, have made your peace with the less, finite versions of existentiality, you still have to exist. And for me, that's what keeps me up at night. It's worrying about the stress of things. If something takes another turn, how do I support these other parts of my life? Another thing that you brought up is the kind of mental health concerns you have for people that aren't you, or that are not as structured around the physicality of your cancer diagnosis. How is your experience? If this is getting a little bit too personal for you, you can tell me. But what kind of mental health treatments have you looked into? What type of therapy have you found successful versus unsuccessful? I know for myself, I didn't find traditional therapy to be of much help when I was early into cancer, but as time has gone on, I've learned to use it as a tool. Have you had anything that really stands out to you?
Yes. And I'll start by saying that I don't remember. I'm sure a lot of services were offered when I was first diagnosed, and I just don't remember. I remember when you go to your appointments, getting the typical depression screening with the questions. You need a social worker, but my cancer center does have a integrative care, i.e., palliative care group, and one of those branches includes mental health. So for probably, I would say maybe 3 years or 4 years now, I actually have sessions with this psychologist. She actually is specializing in oncology, so that is very helpful because that's what she sees. So she's familiar with the whole concept that yes, cancer may be a physical thing, but it impacts your whole being. So things like side effects may impact you, etc. So um, even though I've been stable, the main reason I actually started seeing her is precisely because of what you mentioned. So work full time, work gets very intense at time, may not be physical, but the amount of mental energy in me that just drains your energy. And health insurance and all these benefits are actually through my employer. So for me, it's like I got to keep working because if I don't, then who's going to pay for my meds? How am I going to be able to afford treatment? So the main reason I started seeing her was because I was just struggling with a lot of stress. So I find those beneficial. Initially we used to see her about once a month. My first session, I think we did like a couple of sessions in person, but the ones we do now are actually virtual. So technically I drive how often I want to see her. I see her kind of about every 3 months or so, with the caveat that if I want to see her more frequently, I can actually change the appointment. Separate from that, there are things I'm trying to do to just be more present and grounded. And also try to just keep multitasking at bay, which I think most women are really good at, but it's just probably not very helpful. So I do have, part of my routine in terms of just taking care of me include acupuncture, include massage therapy, chiropractic care. Acupuncturist is partly also because of side effects, joint pain and osteoarthritis, etc. And also just trying to just do a few things, just better take care of myself, and just trying to get my mind just to take it breaks from time to time. So I love doing yoga and practices like Tai Chi. I try to just practice gratitude. I'm just an eternal glass half full person. Very few times I'm down the doom and gloom. And I found that's just very helpful to just always try to find something to be grateful for, and just continue trying to just walk one step at a time.
Yeah, it's you played off a number of really important things that were brought up in the podcast. Dr. Bohon brought up the kind of need for supplementary things in her eyes, such as acupuncture, such as, coming up with these sleep studies to see how the quality of life gets better when they're done. But also, like, the thing you brought up about the accessibility on your terms is one of the highlights of that episode. They talked about the advent of telehealth being so important for cancer patients for a number of reasons. One, mobility is not always the easiest thing, and especially when mobility, the need to travel to and from therapy takes up your time. Cancer patients have an incredibly impacted schedule. In my experience, everyone I've talked to says, between appointments, trying to keep up with real life to manage, your life around cancer, and just energy wise, it's a lot easier if you can select the time and frequency, which I think is great. In your advocacy work, have you talked much with patients about their knowledge of therapy being available to them? Because it sounds like you have a great suite of mental health resources in your clinic, whereas I do as well. I'm being treated at UCLA Health, but I know that when I got started, everything was in one ear and out the other. I just didn't have the capacity to even process. They said, sure, there's therapy available, mental health resources, and I couldn't get out of bed. I was just too depressed or too shocked. What have you found in talking with other people, or even in your own experience, about the accessibility when it needs to be there?
Yeah, I think there's a few things. Accessibility. Not everyone that is in treatment has ready access to a place where has the mental health resources they need. So in a larger cancer center like the one I go to, there's all these services. I know people that live in rural areas where just seeing someone, even for that first appointment, they really do not have they're not, geographically speaking, they just don't know who to go to, or they don't even know that those resources exist. The other thing that makes it difficult at times, and I can talk about it because part of the Hispanic culture, mental health is just not something that I grew up listening to as another dimension of me as a person that I needed to take care of. You get a cold, you go to the doctor, get your meds, you move on. But it's just that the way you're raised, try to deal things on your own, and some of the stigma around mental health, most people sometimes, some people equate it to like you go to a mental health provider, immediately they're thinking they're just going to give you meds. I'm like, no, there's just, the way I explain it is they're trying to give you a different perspective of how to manage the complexities of what we're dealing with on the day to day. Some of it is just money. Not everyone has the resources to pay for them. So when I've talked to other patients or even caregivers, always remind them, yes, take care of your body, your cancer, make sure you're on the best path based on what you define as quality of care and what your doctor says are the right treatments for you. But don't forget, you're a person, mind, body, and soul. You got to take care of everything. So try to find what works for you. And if you don't know what you have available, talk to your social worker, talk to your nurse practitioner, see if they have a mental health therapist or a psychologist. And many cases, for many of them, it's like we're introducing that for the first time. But it is so encouraging when you actually speak with them again, and you hear how it's been helping them. And it's just another resource in their toolbox. So, but I know that one, not everyone remembers when that may have been brought up during our consults. Two, many of them hesitate because they're not sure that's something that's acceptable and that would work for them. And three, some people may not be able to afford it. So part of the other things I try to do is also introduce people to organizations that can help provide some financial resources to help pay for some things that may not be affordable for people.
That's fantastic. I think that's the big takeaway for me for advocacy is that there's a pathway from what you believe is best and acceptable as an individual, and then you start telling other people to do the things that have worked for you retrospectively. Basically, at this point in time, because I'm a few years into working as an advocate and being very open about my experience, and I've found that it's almost the best form of mental health relief for me because you start one way or another, whether it's in person, at a clinic, online, on a social media forum or something like that, you start to tell people about your experience. And then you find patients who have the same experience and you feel safe expressing your experience to them. And all of a sudden you can't stop, or at least I know that I couldn't. And like I said, at this point in time, people say, wow, you're doing a great job of, helping other people. And I'm sitting there going, man, this is for me. The helping other people is residual. I mean, I'm kind of kidding. It's a little of both, but have you found that to be a similar experience where the advocacy is kind of self-fulfilling and that it helps you as well?
It is. Serving others is my thing. And it's just, I want to bring joy to people. And in my case, the way I do that is by helping, one, give them hope by sharing my story, two, give them the tools and just information for them to just go and find and become educated as a patient, and then make the best decisions for what they want to get out of life. It is, yes, like you said, it's like energizing for me. You're technically giving, but so many times just what you get back in return is huge. It's just not the people that you meet and you see sometimes immediately how they feel better about what's going on, or at least they know where to turn to if they need information. And it's 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 really life changing. It really is. And sometimes I have gone overboard with the volunteering. So I've learned when sometimes I just try to give too much, and I recognize it's time to kind of reel it in a little. But it's it's amazing what it does, I think, for us as cancer patients to just see how sharing a piece of us and our experience can make a difference in the life of others. And someone a while back, I remember, not sharing your story. It's a disservice. You're not serving anyone. So I chose fairly early to just be vocal about it and share it. And it's helped me cope better. And I know that it's helped many along the way. And as ironic as it sounds, if I were to look at the number of people I've met, many that are really good friends of mine, if I had never been diagnosed, I probably would have never met 99% of those people. So this is not a disease that you deal better when you're in isolation.
Not even close.
By building that tribe, and part of building that tribe has been being an advocate, it just makes it so much more manageable.
Yeah, absolutely. And that is a great way to kind of tie everything together as we come to a close here. You know, that the advocacy piece, when we talked about how fulfilling it is, it's not like a pat on the back thing. It's more that it's the only way you can get through this in a rational way. At some point, you understand that we are all here to take care of each other as a community, because it's a hard community for people who aren't in it to understand. And that's actually, you know, the reason we're sitting here talking about a separate podcast that illuminates information is because as time has gone on, as cancer care has gotten better and standard of care has gotten better, I think we've learned that things like these aren't just optional, they're kind of critical. And, you know, with the internet being relatively new in the scheme of the world and social media and our ability to connect like this at, you know, the drop of a hat, it's easier for people to share their experience and make it accessible. So it's changing the way that research is done and that patient experiences are quantified so that 20 years down the road, you know, they'll have more humanistic side to cancer treatment. Hopefully it'll be a much smoother experience for everyone. Sheila, I'm going to wrap it up here, but I want to thank you again for coming on. And this has been great. I love talking with other patients. I love hearing their stories. Is there anything else you want to add as we sign off here?
Thanks so much for the opportunity. But for those listening, just remember, when you're taking care of your cancer, you just got to make sure you take care of every single part of you. And that applies not only to you as a patient, it also applies to your caregivers. Because if you're listening to this and you're a caregiver, we need you to also take very good care of yourself, because you can't really pour out of an empty cup. So this goes both to providers, caregivers, but also for patients. Just take good care of yourself and don't let the stigma or I don't know if it's going to work, just go for it. Just add as much dimensions to wellness as you can, and just don't neglect that mental health component.
Well, that's a great way to wrap it up here. And I want to thank you again, Sheila. You know, if you haven't watched the Manta Cares Patient from Hell podcast, go do that. There's a lot of illuminating information there. Sheila, have an awesome day. Thanks one more time.
Thanks, you too, Mike.
This podcast, show notes, and newsletter is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or any materials linked from this blog is at the user's own risk. The opinions of the speakers are their own and do not represent the opinions of organizations they're affiliated with, nor do they reflect the opinions of Manta Cares Inc. or Manta Cares' sponsors. This episode was supported by an award from the Patient-Centered Outcomes Research Institute.